with the same purpose. 32 volunteers from Australia, Vietnam and Cambodia have come together and successfully completed our planned mission, which is to provide some medical services to the stateless Vietnamese communities in Kampong Chhnang and Kampong Luong. Our first stop was Kampong Chhnang Community Hall. Kampong Chhnang is a harsh, remote and underdeveloped area. This is where more than 300 families have resettled after being moved from their residing floating village of Kampong Chhnang. We set up our working station at the community hall and carried out general medical, breast and cervical examinations. A huge effort from our Vietnamese gynecology team to bring some essential and delicate equipment to Cambodia so that they could perform the highest possible standard for cervical cancer screening. Given our limited available resources and working conditions, the collected test samples were processed by our wonderful laboratory technician team, and the results were available within 1 hour. We have also set up a follow-up process in cases of an abnormal result detected. After 2 hard working days at Kampong Chhnang, we traveled to Kampong Luong, which is another hour by bus and boat from Kampong Chhnang. The remote floating village of Kampong Luong is composed of more than 1,000 families. Because of their unfortunate living situation, sanitation is extremely poor. We were a bit overwhelmed by the bad odor while traveling by boat to our designated working stations. The stateless children from Kampong Luong are not officially accepted to schools, nor have the adults had the rights and benefits as Cambodian citizens. They have no means to access basic medical services. Their life is precarious and futureless. We perform similar work as in Kampong Chhnang. After 4 days of work, general medical examinations and prescribed medication were provided to 458 people. 169 breast and cervical examinations were performed on women under the age of 50, with 33 cases found with abnormal results. 16 cases will need 12 months follow-up, and 17 cases will need further tests and possible treatment. Thinking of a more lifelong benefit, we have also initiated a vaccination program against human papillomavirus, HPV, which are commonly found in cervical cancer. 92 girls from the age of 9 to 16 received the HPV vaccine in this trip. We are hoping for future projects. With enough funding, the vaccine can be given to a larger number of girls in this age group and up to 25 years of age. Last but not least, we feel very blessed to have a wonderful and cohesive team this time. Most of our volunteers met each other for the very first time, but with the same passion to help the underprivileged people. We have formed an instant and strong bond of friendship. This mission was not possible without their hard work and dedication. Salutation to all our volunteers. We also like to express our deepest gratitude to all our donors. The Rotary EClub of Greater Sydney, Sister Young, Sister Tu, all doctors, technicians and volunteers from Australia, Vietnam and Cambodia. You have made our mission possible. We appeal for your continued support in future so that we can carry out more projects in hope to improve some quality of life for the stateless floating village communities and the underprivileged people.